Have you heard of the itch that rashes? What does that even mean? Does your infant seem to have dry cheeks that you can't seem to get rid of? Is your child constantly itching their skin? These may be signs of eczema or atopic dermatitis, a common skin condition in childhood and beyond. Today we'll go over the causes of eczema, its symptoms, and management strategies to try. I'll also cover when it's a good idea to see a dermatologist or allergist, so make sure you stick around until the end. I'm Dr. Mona, a pediatrician and mom. I help empower parents with easy to understand information so you can make the best choices for your child. Make sure to like this video and subscribe here to Peds Doc Talk TV to stay up to date on all the latest videos and new content. Eczema is a chronic inflammatory skin condition characterized by dry, itchy, and inflamed skin. It's called the itch that rashes because the condition can lead to a vicious itch-scratch cycle where itching leads to scratching, which results in the release of inflammatory mediators, leading to the development of the classic eczema that you may see, more dry skin, and subsequently more itching and scratching. In the United States, it affects approximately 15 to 20% of children, so chances are you know someone who has been affected by eczema. Most of the time, symptoms begin before 5 years of age, with 65% of those affected during childhood presenting before age 1, and 85% presenting before age 5. Most children outgrow eczema by their adolescent years, but for some, symptoms can persist into adolescence and even adulthood. It's also hard to predict who will outgrow their eczema and who won't, but family history may play a role. So if either parent has it in adulthood, it can be such that the child has it into adulthood as well. The diagnosis is clinical, which means how it presents on the skin, and there's no blood test to make the diagnosis. Those with eczema tend to have dry, erythematous, or red skin, and scaly plaques or patches. Dry skin with intense itchiness can be the cardinal symptom of eczema. Of note, darker skinned babies can spend months being undiagnosed since the rash doesn't appear as red or inflamed on their darker skin. So if your child has dry patches that are irritated and you're having trouble managing it, please advocate and bring it up to your clinician. Eczema rashes can itch. In infants and toddlers, eczema typically presents with red, scaly, itchy lesions on the cheeks, scalp, wrists, ankles, and severe cases can result in oozing skin with crusting. In older children and teens, eczema is more likely to appear on the inside of skin folds, specifically inside the elbow and behind the knees, as well as around wrists and ankles. For those who experience long-lasting symptoms, eczema can result in pale or dark patches of skin. And with repetitive scratching with those with chronic eczema, the skin can become very thick, something called lichenification. Eczema is caused by a combination of genetic and environmental factors. Skin barrier dysfunction, environmental triggers, genetic predisposition, and immune dysfunction are all possible reasons. One of the biggest risk factors for eczema is having a strong family history of atopic conditions. Atopic conditions include eczema, allergies, asthma, and these conditions commonly occur together due to the immune system overreacting to certain triggers or substances. In regards to skin barrier dysfunction, people with eczema have a defect in their skin barrier, something called filaggrin, which plays an important role in the skin barrier's function. Filaggrin brings together structural proteins in the outermost skin cell to form tight bundles keeping moisture in. Without it, eczema skin allows moisture to escape and irritants to enter, hence the classic symptoms. This can trigger an immune response and inflammation and dryness in the skin, which is classic for eczema. The most common environmental triggers of eczema are heat and sweating and also extreme cold weather. Weather fluctuations can also play a role, including hard skincare products like soaps, lotions, detergents, or fragrances, wool or certain synthetic materials, emotional stress, and in some cases illnesses like the common cold. The reality is the environmental triggers vary person to person, hence why part of eczema care is watching to see what flares up your child and removing or reducing exposure to that irritant or being more vigilant during those times. Eczema care is unique for each individual and can be hard to manage for some, given the skincare and medications, if needed, are frequent throughout the day. It can also feel lonely because even though you may know someone who has a child with eczema, the management can be very unique from each individual. Nearly half of children, or parents of children with eczema, report a negative impact of the condition on quality of life, poor sleep, fatigue, and appearance. So we want to help manage this. The main components of eczema care include maintaining basic skincare and moisturization, this is so important, noticing and eliminating triggers, also important, topical ointments, wraps, and medication, and managing and monitoring for secondary infections or infectious triggers. The maintenance phase is so important for eczema, and this includes daily consistent use of a moisturizer to hydrate the skin. It's so important that this be continued even when symptoms are well controlled in the child with eczema. I cannot stress this enough. Think of this as a preventative phase. Many times parents will stop the moisturizing when they see no flare-ups, but with eczema, the maintenance is key. I want my eczema kiddos to be greasy when we touch their skin. Hydrating the skin consistently helps prevent dryness from developing and reduces the likelihood of needing to use prescription medications. Ointments are ideal, which are thick and come in a tub, so you can't pump it out of a container. Things like Aquaphor Healing Ointment or Vaseline were great to lock in moisture in the skin. But some parents or children complain about its greasiness, but the idea is that you want to keep their skin greasy. Thick creams are a good alternative, like CeraVe Moisturizing Cream, Cetaphil Moisturizing Cream, or Vani Cream. I like mixing a cream like CeraVe with an ointment like Aquaphor Healing Ointment into a special ointment into your hands and lathering this on whenever you notice the skin dry. Typically, creams advertised as hypoallergenic, fragrance-free, and anti-itch are good options. Other favorite ointments on the market include Tubby Todd All Over Healing Ointment or Eczema Honey Cream. Eczema Honey Cream is safe to use on infants and it contains honey, which is a natural anti-inflammatory, but it's okay to put on the skin. If you use it, try the nut-free version. Popular other ointments and lotions to consider include coconut oil, Eucerin, Aveeno Baby Nighttime Eczema Balm, and or Glad Skin Eczema Cream. For any ointment or lotion, make sure to patch test the new ointment on your child's skin before using all over. And like I mentioned, there's unfortunately no one-size-fits-all best option out there for skincare ointments for eczema. So what works best for one child may not work well for another. You may have to try a few different options or a combination of different ointments or lotions to figure out what works best for your child. A big part of treating eczema is also to notice triggers for your child. It is important to avoid triggers such as harsh soaps, allergens, and extreme temperatures. For some kids, you can identify a certain trigger based on history. For example, you put them in non-cotton pajamas and they're scratching all night. Or try a scented lotion and they flare up. Or grandma was wearing a certain perfume and they flare up. Many children with eczema benefit from hypoallergenic, fragrance-free detergents, soaps, and lotions, but it's unnecessary to switch products unless you feel like your child's symptoms are not well controlled. Also, I advise to avoid fabric softener for those with eczema, as this can dry out the skin. Stick to hypoallergenic detergents, such as All Free and Clear as an example. Common environmental triggers to consider are smoke. A smoker in the house can lead to skin irritation in the eczema child. Also consider the pajamas your child is in and the bed sheets. 100% cotton or bamboo can help with moisture and keeping moisture in. Also consider adding a water softener to your bath or shower, as hard water can irritate and dry out the skin, especially those with eczema. The frequency of bath needs depends from child to child. A study showed that frequent bathing in lukewarm water actually decreased dry skin compared to infrequent baths as long as moisturization was applied after. Therefore, it's helpful to give short, lukewarm baths every 1 to 2 days and apply moisturization afterwards. Pat dry the skin and moisturize right after to keep and lock in that moisture. If your child responds well to baths every day, there is no need to space it out. This is another instance of figuring out what works best for your child and their eczematous skin. So if we've removed triggers and you are staying on top of skin moisturization, which are so important, sometimes prescription medications or other remedies may be necessary. A non-medicated strategy is using wet wraps. Wet wraps can also be used for more severe cases. To make a wet wrap, you first apply a moisturizer, ideally an ointment like Vaseline or Aquaphor Healing Ointment. Then you apply a dampened cotton wrap to the affected area and then cover it with a dry wrap and then pajamas on top. The wet layer should not be allowed to dry out and can be replaced if needed. This helps reduce itchiness and limits access to the skin so that the child can scratch it. Another medicated option is to put topical steroid, if needed, to the inflamed area and then the moisturizer, covering the skin with a cotton cloth that is dampened with warm water, and to follow with a dry cotton pajama set. If you see the slightest redness and/or your child is itching a lot at certain areas, continue your moisturizers and ointments, but you may need a prescription steroid prescribed by your clinician. This phase typically includes adding topical steroid use to reduce the inflammation of the skin. Topical steroids work by constricting the blood vessels in the skin and preventing inflammatory cells from entering the area. This helps with skin redness and irritation, but also helps reduce itching. There are many different strengths and formulations of steroids, and your clinician will help determine which is best for your child and if they need it. Typically for mild disease, low potency steroids are effective. The lowest potency steroid is hydrocortisone 1% ointment, which is available over the counter, and ointments are better than creams. Topical steroids are typically applied 1 to 2 times a day with your normal moisturization for 1 to 2 weeks. I usually recommend using it for 2 weeks at the most and giving the skin a break. If redness and itchiness improves, you can stop it. If you have a child who tends to flare up in the same area, a regimen could include continuing your moisturizers and putting a steroid to prone areas 2 times a day every 2 to 3 days or on weekends. But this is something you can speak to your clinician about to get an eczema action plan. Local side effects from topical steroids include thinning of the skin, stretch marks, or discoloration of the skin. So we love to lean on moisturization first and the lowest dose possible for steroids and build up if we use them. We lean on the lowest dose steroid on areas where the skin is naturally thinner, like on the face or in the diaper area. So your clinician may prescribe 1 steroid for the face and 1 for the body. If steroids are recommended on the face or buttocks, they are typically low potency and for a shorter duration. There are a few other prescription medications that are non-steroidal and approved for the treatment of eczema. It is my opinion that if you are reaching a point where you are on top of skincare and using steroid ointments more than 2 weeks per month, it's best to see a dermatologist to discuss non-steroidal options for your child's eczema. These include medications like Protopic, Elidel, and/or Eucrisa, especially if the eczema is affecting areas of the skin like the face, eyelids, neck, and skin folds. Tacrolimus or Protopic and Pimecrolimus or Elidel are topical calcineurin inhibitors, and side effects include burning, stinging, and or itching at the site of application. So like any ointment, your clinician may ask you to patch test it first. Eucrisa, also called crisaborole, is another type of medicine that attacks the immune pathways that cause the annoying symptoms of eczema. Speak to your clinician or a pediatric dermatologist if you have questions about any of those medications. Eczema is often called the itch that rashes because children's skin is itchy and then they scratch, further worsening the inflammation and redness on the skin. Besides the medications we just discussed, there is no clinical evidence that non-sedating antihistamines like Zyrtec, Allegra, or Claritin are effective at reducing itching. However, anecdotally, some parents have seen some response for their kids. Hard to know if this is a placebo effect, so clear use of antihistamines for eczema with your child's clinician. As always, discuss with your child's clinician if any of these medications are good options for your child. Nails should also be trimmed short for children to prevent the risk of scratching the skin and further damaging that skin barrier. Patients with eczema are at a higher risk for skin infections due to the disruption in their skin barrier and scratching. These skin infections can be mild, such as impetigo, which is a staph or strep infection that affects the skin. It typically presents with itchy, fluid-filled blisters or lesions with yellow crusting over them. Rarely, a more serious infection called eczema herpeticum can occur, which is the spread of the herpes simplex virus to the skin. It presents with painful, fluid-filled blisters that break open and leave sores on the skin. Children with eczema herpeticum generally feel unwell and are often listless and febrile. This illness needs prompt medical attention and needs to be treated with an antiviral medication. For a child prone to superinfection with staph, bleach baths may be recommended where you mix 1/2 cup of standard bleach, non-fragranced, in a standard bathtub filled up with 4 to 6 inches of lukewarm water and place your child in this bath for 5 to 10 minutes, 3 to 7 times a week, depending on need. Of course, make sure you are monitoring your child during this bath so their head does not go under. Make sure to pat dry after and apply your moisturizers as you would. Remember, bleach baths are a component of treatment, so it's important to speak to your pediatrician or dermatologist if you have any questions. There is some controversy about whether food allergies exacerbate eczema symptoms. There is currently a lack of evidence that mass dietary restrictions help reduce symptom severity or prevent flares of eczema if there is not an already known food allergy. True food-induced atopic dermatitis is uncommon. However, children with eczema tend to have a higher prevalence of developing food allergies later in life. The eczema presents first and then the food allergy, and not likely the other way around. But why do babies with eczema have a higher risk of developing food allergies? It all goes back to the structure of the skin. As the skin barrier collapses or is vulnerable, it becomes leaky. It loses moisture and allows allergens, including tiny food particles, in through the skin, and irritants to enter the skin as well. This in turn triggers an immune response. This immune response subsequently can develop an exaggerated response when allergens are later eaten. Thus, skincare is extremely important in eczema to protect that skin barrier, irritants from entering, and food allergies from developing, going back to number 1, which is moisturizing. Babies with eczema should be introduced allergenic foods early, as soon as they start solids. Children with eczema and or food allergies can have falsely positive allergy tests, which means the test is saying that your child has an allergy, but the child has no clinical issues. So it's important to discuss testing with a pediatric allergist. If your child has moderate to severe eczema, so eczema that does not respond to normal skincare regimens, an allergist visit may be good to discuss a plan and if testing is needed. Keeping a food diary can also help to notice potential triggers. We don't recommend removal of foods without discussing with an allergist because this may restrict their diets unnecessarily and also restrict nutritional needs. Speak to your clinician or a pediatric allergist for more guidance. Based on the history and physical, they may recommend a trial of eliminating the food from their diet. Foods can be a trigger for worsening eczema in some children, known as a flare, but it did not cause the eczema to begin with. This means that avoiding the food may not cure the eczema, but limiting the food for some children may help to prevent them from having future flare-ups. This is why if you feel that there is a correlation between a food and flare-ups, bring it up to the clinician. Although it's rare, it's not impossible. There is an increasing push to recognize the gut as an important aspect of treating eczema. And although we still need more research to fully understand the connection, it is my personal belief that gut health is important. In terms of probiotics and eczema, we do not have good research studies showing efficacy or lack thereof, so speak to your child's clinician about probiotics. I advise you to be wary of any online companies selling non-approved supplements for eczema, as they may not be safe because they're not regulated. It's worthwhile to see your clinician for the following reasons. You're unsure of the diagnosis and need an eczema action plan if it is in fact eczema. The eczema action plan is not working. You've tried moisturizers, as mentioned, and removing triggers, and it's still hard to manage, so you may need topical steroids or to see a specialist. You're using topical steroids for more than 2 weeks per month. You may need something else or to see a specialist like a dermatologist. You have closely monitored food exposures and feel that there is a connection between certain foods. You may want to see an allergist. Your child is feeling ill with a unique rash and eczema. You'd want to make sure it's not a super infection. In terms of specialists, both allergists and dermatologists are comfortable managing eczema. But if there's also a history of food allergies, allergic rhinitis, so seasonal allergies, or asthma, seeing an allergist may be more helpful. A dermatologist is most useful if basic management with the pediatrician is not helping manage your child's eczema. There you have it, all about eczema, the causes, possible triggers, management strategies, and when to see your clinician. Do you or your child have eczema? What's worked well for you? Please leave questions or comments below and help this community feel supported. I would love to hear about your experiences. If you found this information helpful, please like and share this video and make sure to subscribe to be the first to know about new videos published. I'll see you all next time for another video here on Peds Doc Talk TV. Stay well.